Capsule endoscopy is a fantastic addition to the armamentarium that the gastroenterologist has in investigating patients. You know, it's dark inside. You know, if a doctor wants to look in your mouth, they use a torch. If they want to look in your ear, they need to use a torch. But going beyond that, you can imagine it's dark as a dungeon. And therefore, inspecting the inside of the digestive tract requires light to be visible. And this is what endoscopy is all about. But until recently, the only way to do that is by using a long, sinuous endoscope, sometimes about 1.5 meters long, that delivers light into the bowel and gets a picture back. And for the patient, it's not the most pleasant of experiences. However, towards the end of the 20th century and beginning of the 20s, a guy called Gavril Idun, who is an Israeli inventor, decided to squeeze a television studio into a capsule. And I've got an example over here. This over here is a capsule endoscope. And inside this little capsule, there's a light source, there's a camera, there are batteries, and there is a method that the capsule has for sending the video of your internal organs from the gullet, the stomach, the small bowel, and the colon to a little box that you wear without being connected to anything. And it becomes an absolutely painless procedure. So it's an evolution for investigating the digestive tract, relatively painless, well, very painless, and from the patient's point of view, offering a much gentler healthcare experience. Once the patient has swallowed the capsule, the video provides an image from the tongue to the toilet. It travels all the way down the 25 feet of digestive tract. Yes, that's how long the digestive tract is. And as it moves along, powered by peristalsis, which is the method that the body uses to push food along, it is taking a video of the inner lining of the digestive tract. So swallow, go home, and while you're doing that, the capsule is sending a video of the gullet, the stomach, the small bowel, and the large intestine. Pass in the toilet, and that's the end of the story. So therefore, capsule allows you to scout the inner lining of the digestive tract without the patient experiencing any of the discomfort, not having to be admitted to hospital, and not requiring analgesia or anesthesia. Clearly, the aim of any form of endoscopy is to decide whether the patient has got a problem affecting the inner lining of the bowel. So, for example, hiatus hernia, stomach ulcer, ulcerative colitis, Crohn's disease, polyps, tumors, etc. But I'd say at the outset that by far the majority of patients who visit their GP or their gastroenterologist do not have problems of the mucosa. The problems lie deeper. They lie deep to the inner lining. So the idea of capsule endoscopy is really to be a drone or a scout to try and decide who needs an endoscopy. If the capsule delivers a video which doesn't demonstrate any obvious cause for the problem, well, the patient needs maybe some other investigations, but certainly not a tube pushed down their throat or up through the rectum. On the other hand, if it does detect an abnormality, it allows the practitioner to decide whether an endoscopy is necessary. For example, if it shows that there's a hiatus hernia, well, you know, not much more is necessary. You don't need an endoscopy. On the other hand, if there's a polyp of the colon, and it's a large polyp, then obviously that would be an indication to send the patient off for a traditional colonoscopy. So in essence, it's very effective at interrogating the inner lining of the digestive tract, and it's asking and answering the question, who needs an endoscopy? Any disorder of the inner lining of the digestive tract is amenable to diagnosis by capsule endoscopy because the technology has advanced to the point where it's possible to examine the small intestine and the large intestine, and indeed the stomach, with one swallow of one capsule. There are capsules that only examine the stomach. There are capsules that only examine the small bowel. So the clinician decides which bit of the bowel do they want to look at. Do they want to look at the top end, the middle bit, the lower end, which is the colon, or the entire digestive tract from top to bottom? So there are a selection of capsules that one can choose. Now, the question is, what can it diagnose? Well, it can diagnose anything that is visible. So, for example, in the small intestine, it can pick up disorders such as Crohn's disease. People who have unexplained anemia, it's able to pick up whether there might be like a bleeding nose. It's not a bleeding nose, obviously, a bleeding intestine, but the same sort of idea, an oozing blood vessel in the small intestine. It can pick up small tumors, celiac disease, and in the colon, where it's really, really finding its place, is able to screen for polyps, because as you know, there's a big move to encourage people to have their bowels checked out at around the age of 60 or 55. At present, it's usually around about 60, to determine whether they have colon polyps, because colon cancer begins with a polyp, which is a benign condition. And if one finds a polyp, or in fact a small cancer, then one can cure the patient's problem. So anything that can be seen on the surface of the digestive tract is amenable to diagnosis by this minimally invasive investigation. So in terms of safety, it's fantastically safe. It's very, very, very unusual to have any complications of capsule endoscopy, because it's the same as swallowing a capsule or same as swallowing food. And it doesn't involve pushing an instrument through the bowel. May I say that traditional endoscopy is very important. I'm not trying to undermine it at all, but I think only those people who actually need a traditional endoscopy should be given that opportunity. So it's really extremely safe, and it's painless. As long as you can swallow and take a sip of water, that's about all that's necessary. However, there is a buildup, because the capsule has to pass through the digestive tract, which is, particularly in the colon, full of stool. And if the capsule gets stuck in the mud, or the image of the bowel is impaired by virtue of the fact that the preparation of the large intestine, particularly where stools are formed, is inadequate, then obviously it can't do its job. So for a couple of days before the test, and this is particularly for the colon, the patient is asked to take a low-fiber diet. The day before the test, to take a liquid diet, which is a whole series of liquids that we recommend people take, just to keep things non-solid and non-fiber. And that's about it. And they usually go to their local hospital where there's a capsule unit, where a nurse delivers the capsule. It's very unusual for a gastroenterologist to need. There's no technical skill involved in the swallow. So there are nurses who are specifically trained to deliver the capsule. And particularly in the COVID era now, the idea is that the patient goes straight home, doesn't hang around in the waiting room or in a situation where there are lots of other people backwards and forwards. They go home, and the rest of the test takes place wherever they might be, usually at home. They pass the capsule into the toilet, flush it away, where it's captured by the sewerage system. There are mechanisms for catching these capsules. And the patient just returns the little receiver box, which they've worn on their belt, to the hospital. And really, that's the end of the procedure. So it really is minimally invasive, and a fantastic contribution to gastroenterology, and particularly for the patient. This does really provide the opportunity for a gentler healthcare journey.